The leadership of Uganda Nurses and Midwives Union has initiated a Boda loan scheme for nurses to enhance their incomes. This follows a partnership with Simba Automotive Company with Uganda Nurses and Midwives Union, and nurses from different regions are beneficiaries.
First of all, it's going to enhance their mobility in times of need, when they are coming to work, when they are going out. It can also help them as an income generating project so that they can make it a Boda and they get some money. But it can also serve the community in case of any need, in case of any emergency. When someone gets maybe an accident or someone gets an attack in the night, and when the motorcycle is nearby, people will use it. It is quite very good, and I want to thank the leaders for this innovation because it is going to enhance their income in their homes.
Workers Member of Parliament Byakatonda Abdul says the loan scheme will improve efficiency in transport for the nurses and encourage them to have more enterprises. He says other unions can also embrace such initiatives like the Boda loan scheme.
This is meant to ensure that, one, to improve on efficiency of transport, because the nurses have been suffering with transport. So the motorcycle can drop the nurse, then the boy can ride and give the nurse on average at least 10,000. which can be 300 extra income. Then we're also encouraging them to have enterprise at home, such that if you are rearing hens, they are laying eggs, you take your eggs to the market. If you're in horticulture, you can take your product to the market. If you're in bee farming, you can take your product to the market. So the motorcycle can be a mode of transport that can increase on efficiency and transportation of your product to the market. So we encourage them to ensure that at least one, they raise 1,050,000 shillings, then they can get this motorcycle. With our partner Simba Automotive, we shall ensure that at least we recover money slowly and ensure that people have their motorcycles, such that at least one will have a side income rather than relying on salary only.
The President, Uganda Nurses and Midwives Union, Justice Cherop Chiplangat, says the loan scheme is timely and highlighted challenges faced by nurses that need redress.
They travel so long distance, so we hope that this motorcycle will take a nurse from his place of her place of work, home to place of work. So meaning that nurses will reach on duty early enough, other than walking. So in the event that the nurse has finished duty, the nurse also has to reach home well and safely, other than walking, other than jumping on a taxi, other than spending more money on public transport.
Birungi Annette, the National Treasurer, Uganda Nurses and Midwives Union, says more money is to be injected in circles.
Nurses of Uganda are facing enormous challenges, especially when it comes to maintaining themselves, or what I can call welfare. There is a very big challenge when you visit a nurse who does not have accommodation. And in some health centers, actually, they sleep like 4-3 in one room, and others walk long distances. So there is a lot that we face while delivering service of health.
Sudat Kaye, Mary Namkose, UBC News.